I cannot tell you what a thrill it is to be here. I have been knowing Viva and Ramsey for all these many years, and when Dr. Narayan was saying, what is special in your quality of life, all I could think about was the people that you know, the people that you've met, the people that you've worked with, that you've loved and that you've fought with and that you've tried to make a difference with. And these few days, that's what this has been for all of us. And we cannot thank you, Viva, and Ilgi, wherever you are, for putting this together for people to beginning to make all of these associations and all of these plans for the hope that UMID and IDPA stand for. What I'd like to do for the little time we're together is really talk about putting our collective information together in the benefit of children in early childhood. Now, many of the things I'm going to say are kind of going to repeat a little bit of what has been said, but I hope that's all right. We'll kind of review together some of the empirical information about why early childhood is important, and then go on to talk about some of the political issues. We know that the brain, and as Dr. Bernadette took us through, develops predictably. We know the neurons are there, and we know that they put themselves together during the first few months of life. And they do it in this way, and I thought you would probably see this 100 times. But this is a very special slide because it's showing that when we're born, we have a certain number of neurons. That's the number we have. But what happens over time is that this doesn't point, that they start to talk to each other. They make the dendritic connections. And it's those connections they're making. Viva told me, is it 700 per second, Viva? 700 times a second, they're making those connections. Now, this slide you've seen, everybody's seen, but this is Julie Richmond's slide. This is the slide of the man I'm going to talk about a number of times, who in 1960 showed this slide around the world to help begin many of the early childhood development programs that we know. And some of that came from the fact that he had been involved with the kind of research that embedded early childhood development. And some of this was animal research, like the Nobel Prize winning Hubel and Wiesel, showing that environment actually changes the structure of our brain. Environment can actually change the structure of our brain. So let me tell you about the historical information from what happened in the United States. And I'm going to talk about Dr. Richmond. Because in the 1960s, Julius Richmond and Betty Caldwell asked a very simple question. They said, what is the development of poor children? And is there a gap between poor children and more wealthy children? And is there anything we can do about that? And this was the birth of Project Head Start in the United States. Now, the reason they asked the question was that they had been working in the University of Syracuse on early childhood development. A lot of what we learned about the developmental milestones of children, how children behave, took place in lab schools in universities. Well, who were the children who were being studied? Who were the children? What do you think? In a lab school in a university? The children of the professors, right? So they had wonderful developmental trajectories for people who came from wealthy and well-educated families. But they had none from children who came from poverty. And so Dr. Richmond said, I wonder what that development looks like. And it didn't look so good. And the reason it didn't look so good was that there was a decrement from the time the babies were born, and it got worse and worse, particularly at 18 months and then 24 months. And they said, this is terrible. What's going on? And what they decided and what they learned was that that environment, that input, was not being coordinated and provided to the children. And so, on over near Viva, they put in an intervention that provided that structure, that framework for the children, and they showed that they could make a huge difference in the lives of these children. Now that was important. It was only 30 children in each group. It was a research project. But what was really important was that Dr. Richmond, he's standing right there next to President Johnson, knew a man whose name was Robert Cook, and he's in the back there. And he told Robert Cook what he'd found, that he could do something to improve the development for children who were born in poverty. And Robert Cook was the pediatrician of Sergeant Shriver, who's right down here. And Sergeant Shriver had been told by Lyndon Johnson, let's make a war on poverty. And Sergeant Shriver said, good idea. How do you do it? What armaments do you use? But Robert Cook heard that Julie Richmond could wipe out the problems that were happening to poor children. And he called him up and he said, get down here to Washington and let's see what we can do. And 6 months later, Head Start was born and implemented and out in the community. Can you believe that? Is it a true story? How many people believe it's true? This is a true story. And the reason I tell it to you is because it's all about friendships. It's all about interconnection. It's all about knowing that if I've got something important, I can share it, and I share it with my friend, and my friend shares it, and something magical happens. And I think that's what's happening here at this conference. Now, I just want to tell you quickly about Head Start, because some of the things that it incorporates include the kinds of things that you all have been talking about, or we all have been talking about these days. Putting health and education together, having social services. And here, this is 1960, folks. They actually were talking about parental involvement. They didn't know how to do it as well as is happening now. And the big thing that's happening now is it's really happening. But they knew it was important. And the second thing here was this one. Local government implementing maximum feasible interaction by the poor. The community involved. So, so important. Now what happened was they tested to see if Head Start worked, and it worked. It increased even the IQ of the children. But over time, there was a decrement in that gain. And this is because early childhood's important, but it is nutrition. It's not immunization. You've got to keep giving the nutrition. And so the children went into a less stimulating environment out of this. Now, the other thing you just need to know, it's had a pretty big impact, over 30 million graduates, and there's been a recent study that showed some really neat things about the children and how they did in school and employment. But the wonderful one is people looked at the parenting practices of the Head Start graduates, and they're really, really better than control groups. Now, there have been other studies, and this is very important work from the Perry Preschool Project, because this is something that Joe was talking about. Perry Preschool showed you can save money by doing this. I just want to give you a little personal experience, which is that in Brookline, Massachusetts, we actually did with Dr. Richmond's guidance and many other people's guidance, the first study looking at what would happen if you enrolled children in public school 3 months before they were born. If you enrolled children in public school 3 months before they were born. And this was the Brookline Early Education Project. It took place in a very nice big old house in Brookline. It included many of the aspects that you all have been talking about: home visits, center visits, diagnostics. We had a lending library. We had all kinds of wonderful things. The program was interesting in that it was not targeted to the poor. It was targeted to the community. So we had wealthy kids, we had poor kids, and we were able to look at some of the differences. We also had a graded intervention so that we had home visits every month, or home visits every 2 months, or no home visits, and we're able to look at the impact of that. What we found was there were wonderful impacts of this program. It worked. And if we looked at the children against a random control, the random control children of families who were highly educated had 20% reading problems at 2nd grade. But the children who were in the program had less, and the children with a moderate outreach program had even less, and the children in the intense program had none, right? So dose response curve, we could show absolutely we could do marvelous things. Those were the wealthier families. For the families who were less wealthy, less highly educated, there was zero difference between the random control and the patient and the program where the parent had to initiate involvement. Nobody was coming to their home. They had to go. And what this told us was, even if we wanted a universal program, we really did have to target for certain groups. We really did have to make that extra effort. And this was a very important philosophical issue in the program. I had the chance to be in an audience like this, and I had been very, very upset about the fact that we had paid millions and millions of dollars for this study. Millions of dollars. And nobody had followed it up. We knew what happened at 2nd grade, but we didn't know what happened at. And I knew that this is Advocacy 101. I knew that in the audience was the lady from the Robert Wood Johnson Foundation. And I said, this is a shame we haven't followed this up, blah, 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 blah. And she came up to me afterwards and she said, okay, Judy, here's the money. You can do it. You've worn me down. So we had the chance to follow these young people at age 25. And what we found was, we made some hypotheses, they'd be healthier, et cetera, et cetera. And we found that the beepers really were. They had better education, they had better jobs, they were more, they signed up to vote more often, they had better mental health outcomes. It was fantastic. But what we saw was that the outcomes, there was a differential effect still. The outcomes were better, the more difference for the poorer kids. So we had done what we wanted to do. We put up flags when we saw this because it was so exciting. So bottom line, ECD works, and it works over the long time, sustain, sustain, sustain. And so there have been, you all know, now meta-analyses that have looked at, BEEP was one of many projects. There have been many other projects that did similar things. The Heckman group did a meta-analysis and was able to show these wonderful savings. And this is the big thing that everybody loves. You go to when as Joe was saying, you go and say, I'm going to save you money. You save an enormous amount of money by putting it in early childhood. So what happened was projects like BEEP led to projects at scale and are still moving along. In the global context, we know, as Bernadette shared with us, the 200 million. We know that the countries that are most affected, and we know that the inputs that put children at risk are quite variable. whether they're structural or they're social. And the Lancet Review has taught us that the impacts are negative in many ways. But we also know that we have some resources. And one of the big resources we have, and it's been mentioned a couple of times, are our community health workers. This is some data from Selfie Bhuta, who've been so successful in the lady health workers in the situation of maternal and infant health, have been able to, in cluster randomized design controlled trials, to reduce maternal mortality by 25% and 29% reduction in neonatal. So we know lady health workers can do incredible, incredible things. So what about ECD? Couldn't this be a wonderful group that could do this? And they are the people who are in touch with the children. They're out there. So there's actually a good history now, starting back in the 1990s with the programs in Jamaica, of community health workers getting out and doing wonderful ECD work. The wonderful program that Bernadette has put together, Care for Child Development, is primed and ready to go. The implementation of it is what's needed, and I really, really hope that this is going to be one of the things that IDPA puts great energy on. It's a terrific, terrific program and can be delivered by community health workers. I just put this couple slides up. Community health workers are really able to do fantastic things. This is back at the time of the 2004 tsunami in Indonesia. This is in an IDP camp, the posyandu's that are held, the community health workers teaching child development, bringing food and teaching child development. Now, much more recently, in Peru, the community health workers bringing these wonderful toys and things for the children to play with, people in abject poverty. Peter's here someplace. Peter Roloff is integrating wonderful nutritional information into the work as well. And I just mentioned this work that is being done in South Africa by my colleague Lisa Butler to indicate there's some, we talk about innovation, there are wonderful innovations that are going on using technology. This one's pretty terrific. Does anybody know about Jive Media Africa? Anybody dealt with them? Yeah. They've created a family, and the family teaches through the cartoons and so forth about health and about child development. They're absolutely wonderful. And this technology can allow the community health workers to go on out into the family, register people, they can observe, they can teach, and they've got videos and so forth. And then, oh my goodness, you know, there's this program in India. Have you heard of it? It's unbelievable. It's called Umid. And think what's been going on in this program with the community health workers who've been taught so much by Viva and others. And you know, and you've learned this over time. So these are the wonderful opportunities that we have. And of course, there's been good data to show that these things are working. So what about the policies and the scaling up? Because this is really now the challenge. How do we scale these things up? There's some good news, and that is that in about 68 countries, there are beginning to be multi-sectoral scale-ups of these kind of programs. I'm just going to tell you briefly about Chile Crece Contigo, again, because personally I know a good deal about it. It is an incredible program which has a targeted situation for children with vulnerabilities, but it's an all-children program. So the government, Chile Crece Contigo means the country of Chile grows with you. You are a citizen when you are born, and you are the most important asset that we have in our country. Talk about political will, right? The program has these 3 different levels. There's all the way from prenatal now. They're actually going out now to high school. and it's been in existence now for 10 years. They are celebrating their 10th anniversary right now. They actually put into their program more in the GDP. We can be embarrassed in the United States about lots of things. Look, that's what we pay, GDP for early childhood in the United States. Not so good. Here's Chile. Low middle income country. They start with the mothers, all these wonderful gifts that they give. This is Michelle Bachelet, is the president of the country. That helps, but they've been able to do these wonderful, wonderful interventions. Now, I want to just mention that we've got lots of opportunities coming along. Because of the Sustainable Development Goals, there's an emphasis on early childhood. We've got pathways to scaling, we've got models, we've got recognition, and we've got many international commissions. We do have, though, one area of difficulty, which I want to just go back for a second, which is that for our community health workers, we really have to put more emphasis there. We're not paying them enough. Most of them are volunteering. And if they are getting paid, they're getting paid half salaries. And this is no way to build a community. So this is a study that came out of Peru. But the thing that's so wonderful is these are highly motivated people, and they really love what they're doing. They really love what they're doing. A great asset. So I'd like to just end with a couple of, not suggestions. Actually, I put these things down, and then over the 3 days, I said, oh my God, how can I say that's a suggestion? You guys are already doing all of this, absolutely all of it. So we need champions. Champions matter. We need eyes on the prize. Who just said it? We need to garner political will wisely. We need to keep making that ROI, return on investment, argument. We need to do, and that's for you researchers, by the way. That's my research line there. And we need to make sure that there's quality in everything we do. But probably the most important thing is keeping parents and children in the center, because they are the centering. So what would that mean for you, Viva, and Ilgi, and for everybody here? I think that leadership training and championship training, everybody in this room is a leader and a champion, might be something to be explicit about. National goal settings, I'm lobbying the folks over here that I think if we could really get down to implementing at a national level the care for child development, that would be fantastic, and IDPA could help with that. Garnering the political will, we've had Joe tell us it's not so easy to meet with the MOH or the president or whatever. But you know what? Somebody you know plays cricket with the Minister of Health. I don't know who it is, but somebody you know is the grocery store person for the senator in the town over. Somebody you know knows somebody who knows somebody who knows somebody. Think about that. Think about who you could, who knows Calcea? Everybody who knows Calcea knows that he played tennis. Who did he play tennis with? Senator Inouye. How did he get everything done? Bunk, bunk, bunk. Oh, I'd like this. Yeah. We use our friendships. Research on outcomes. Oh my God, the outcomes from Dr. Narayan. Oh, so fantastic. Striving for excellence. Don't have to say that to anybody. But the important thing is, with parents in the center, let's dream, let's thrive, and let's enjoy.
So I'm supposed to summarize this. I think we're all inspired. I think what this most brings to my mind is the legacy of greats that we are all following, and the humility to keep moving forward, knowing that we're a huge community. I was a little bit, when Judy was talking about this amazing buzz and energy and the collaborative work in Boston, you know, with the Beeper study, that's an amazing community that was there at the time. We're very fortunate actually now that we can have these kinds of communities that transcend national borders, that can transcend cities. And this is, I think, one of the things that we have here, and emphasizes the importance of collaboration and advocacy that we all do together. Is there anything else I should say to emphasize again, Judy? So we thank you, Judy, very much. Let's open it for questions.
Maybe just a couple.
Yeah. Do you want to control the questions?
Okay. I think we probably have time for just a couple of questions. Folks want to come up to the mics in the aisles.
You know what, if while people are coming up, I want to give you a gift. May I give you a gift? Here's a gift. Dr. Richmond died at age 93. But before he did, as a pediatrician, a scholar, a policymaker, a wonderful person and a friend, he did a few things. Started Head Start, started the neighborhood health centers, wrote the Healthy People Guidelines, which have become the Millennial Development Goals, Sustainable Goals. And then he fought big tobacco. I mean, that was just a little thing. Right? How did he do it? He wasn't superhuman. He was, I think. But here's how he did it. And this was the gift that he gave many, many people. And I want to give you. The gift was to say that we have to have political will. It's very important, but it's not sufficient. We have to have a knowledge base. Very important, but it's not sufficient. We have to have a social strategy. Very important, but not sufficient. These three things have to work in dynamic equilibrium. We have to remember each one at each time and put them together. He was the world's best social strategist. He knew how to take that political will, how to take that knowledge base and make it work. Assess the needs, figure out the population, define a team and a timeline, create an intervention, monitor it, celebrate it, adjust it, and go back right again. Take this gift and use it. It has been so helpful for so many people who do program development, but do it in honor.